Hello, this is Dr. Missy Stec, and today I'm going to talk about evidence-based pedagogy and how we transform the classroom using technology. The goals of this particular lecture are to define pedagogy. We're going to talk about what your personal teaching style may be and your attributes. We're going to look at different learning styles and define 3 different evidence-based pedagogies, and then start to think about how we can integrate technology into those teaching styles and offer you different strategies and opportunities to implement technology. And maybe it's because you need to shift or you want to shift your teaching style and do a better job of integrating technology and active learning strategies. So hopefully this lecture will be helpful to you in terms of transformational pedagogy. So what is pedagogy? It's really the foundation of how we teach. So pedagogy is defined as the method and practice of teaching, or any activity by one person designed to enhance learning in another. So when I talk about pedagogy, the most important thing to consider is you have to have a solid pedagogy for teaching before you can think about technology and technology integration. So we all have ways that we teach, and the purpose of the lecture is to look further behind the evidence about how we teach, and then looking about how we can use technology in a helpful way to help our students achieve a higher level of learning and for us to achieve a higher level of teaching. So remember, back to that definition, pedagogy is an activity by one person designed to enhance the learning of another. So just keep that definition in mind as we move through the lecture. So this slide is the TPAC model. And the TPAC model focuses very much on the content, so what we need to teach. The pedagogy is how we teach it, and then how we integrate technology between the content and the pedagogy. And so the middle section of this is really about the overlap between content, pedagogy, and technology, and that's sort of what we call the sweet spot. But if you notice, there's overlap between content and pedagogy, and so that's you have knowledge about the content and you have a solid pedagogy. And then as you move around, you have the overlap between pedagogy and technology, and the overlap between technology and content. And so what we need to try to find is the way to get to the middle. So Schulman's article actually talks about 7 different characteristics of teacher knowledge. And so basically that means that we practice as teachers based on learned professional knowledge. So those elements include that we know this content matter, that we have some pedagogical content knowledge, so we know how to represent information for learners. We have a knowledge of the curriculum. We have a general knowledge of pedagogical approaches. We know our learners, and we also have knowledge of context in terms of learning. So this TPAC model basically describes how content, pedagogy, and technology are interactive and relational, and that helps us understand that we have to have a grasp of all 3 in order to be effective teachers. So let's consider how you teach. What are your preferences? What works for your students? What doesn't work for your students? Are there strategies that are listed here that you're interested in, or things that you already do? As we work through these ideas today, let's think about one strategy you could implement that would make a difference to your students. So some of these, so integrated learning. So this is learning that brings together content and skills from more than one subject area. And I'm going to talk about integrated learning a little bit later in the lecture. Differentiated instruction looks at how students have a range of learning styles and abilities and readiness. And so you do different things for each type of student. And this can also be differentiated assessment, which means you give students an opportunity to use different methods to demonstrate mastery. Cooperative learning is on here, which is very popular in nursing. And this is how you use cooperative learning strategies and group interaction as a priority. And this is also like side-by-side learning with somebody who may be an expert. And that in nursing, it looks like cooperative skills learning. So basically that means that like the novice nurse will learn from the experienced nurse, and the skills will be taught and practiced and assessed over and over and over again until the novice nurse can move away from being a novice. So those are just some of the ideas, but some of the other ideas here are collaboration, which we do a lot of in nursing as well. I'm going to give you some really great strategies for feedback. Problem-based learning is really popular in health sciences and health professions, especially medicine, but it can be really useful in nursing as well. And then two things that we've been doing in nursing for many decades are didactic learning and context-based learning. And so these are just a few of the pedagogies that are evidence-based, and we're going to go through some of them as we look at this content. So one of the things I'd like for you to think about is how your students learn. And there aren't great, valid, and reliable tools for assessing learning style, but there are some that allow you to get sort of a general idea of the makeup of your class, and VARK is one of those. I've left the website here, vark-learn.com. And so students may be unimodal or bimodal or multimodal, so they may have one strong preference, or they may be a mix of several different preferences. But let's go through each one of these. So visual learners, it's just what it sounds like. So their preferences include informations and graphs and charts, and they're good with the symbolism that they can physically see. So they basically, in order to learn well, they need to be able to visualize what they're learning. So those with a strong preference are more aware of their environment and their place in space. But visual learners don't always include like movies and videos and websites, because those are more kinesthetic, which we're going to get to here in a minute. So oral learners, again, just like it sounds, their preference is for information that's spoken. And so these students learn best from discussion and feedback, phone conversations, discussion boards, oral presentations. So basically, they want to hear and discuss the ideas that they're trying to learn. Students with a preference for reading or writing, they either want to see the words, they either want to read them or write them. So a lot of students and a lot of faculty have a strong preference for read-write modality. But these learners are very focused on language, and they use a lot of quotes and lists, and they reference a lot of books or manuals, and they have a very strong reverence for words. And so these are your read and write learning styles. And then finally, the kinesthetics. Their preference is related to the use of experience and practice. So they want to simulate or do actual activities. And so in this modality, the students are very connected with reality because they're very interested in experience or example or practice. So this is often referred to as learning by doing, which again, we force a lot of in nursing, although we have to realize that not every nursing student is a kinesthetic learner. And that can be problematic, right? If we're sending them to lab and they're not a kinesthetic learner. We understand that they have to learn skills, but that might not be the best modality for them learning it. They need to practice it, but they may need to learn it in a different way. So kinesthetic learners use sight and touch and taste and smell, and they sort of take in all of the things around them to experience and learn things. So those are the four big learning styles according to VARK. Now there are some other learning style assessments that are out there. This one is quick, and students can do a modified VARK assessment in under 5 minutes. And so it might just give them, the students, a good idea of how they learn, and you as a faculty sort of an idea of the mix of what you have in your class, and therefore helping you shape the pedagogy that you use in the classroom. So I'm going to go through 3 evidence-based pedagogies here in the next few slides, and just tell you about what the evidence is behind each one, and give you some ideas about how you may integrate those in your classroom. So what do we know about collaboration? We know that there's consistent evidence for use of collaboration. There have been a lot of systematic reviews, and those reviews basically say that collaboration demonstrates a consistent benefit to students in a variety of different classroom settings in comparison to more traditional instructional methods. So Paloff and Pratt, it's in your references, it's an article from 2005, but it identified specific pedagogical benefits to collaborative learning, including that students will develop better critical thinking skills, they can co-create knowledge, they're better at reflection and transformative learning. So what we know about collaboration is that it actually encourages active learning environments that engage students, that hopefully will get them to a higher level of Bloom's taxonomy. So what we know about collaboration is that you can reach your visual and your oral and your read-writes and your kinesthetic learners, because in a collaborative environment, each person can have a role. Your readers and writers can have a scribe role. Your kinesthetics can have a role where they're doing things and learning by doing. So collaboration offers a lot of flexibility in terms of meeting all of your learners where they are. And the biggest point about collaboration is the level of engagement that you're going to get from all of your learners. So one of the things that we do in our classroom with our doctoral students with collaboration is student-created content. So we have students work in groups to create the content for the course, and it forces people to engage, work together, and really embrace whatever their learning style is to contribute to their group. I like this slide. These are 12 really great principles for collaboration. So it's the idea that the group, the sum of the parts is better than each individual part. So the group is better than each individual part. And so when we talk about collaboration, we're talking about all of these things. We're looking at persistence and creating the right environment, and strategy before technology. So what are you going to do? Like, it's just like what we were talking about with pedagogy. What's the pedagogy before the technology? So getting together and strategizing in with a collaborative effort before you move to technology. This graphic really focuses on the employee, but we can sort of sub in the word student every single time you see the word employee. So it allows faculty to listen better and to adapt and evolve as need be, and to integrate the workflow. So these are good principles, although these are business-based, to consider for the classroom. The second pedagogy I want to talk about is integrated learning. And integrated learning brings together content and skills from more than one subject area. So if you do integrated learning just in a satisfactory manner, you're going to bring in content from a lot of different subject areas, and it's going to be identifiable within one particular course. A better way to do integrated learning is to have a resource that you can use in multiple classes in more than one subject area. So for example, in nursing, what's the resource that you have for pharmacology that can be used in more than one subject area? And then the best really way to do integrated learning is that you really can't tell the lines between, when you're learning pharmacology and when you're learning assessment. And so I'm going to show you an example in the next slide. So this example is about pediatric primary care. So in most nursing schools and most programs, students will take a class in pharmacology, a class in development, a class in physical assessment, in all of these areas that are surrounding this big green circle. And the idea in integrated learning is that the students may take a 2 or 3 course series, and instead of I'm just going to learn the pharmacology and then learn to apply it, it's that they'll talk about a particular disease process. Like I'm going to talk about asthma in pediatric primary care. And when we learn about asthma, we're going to learn about well management, sick management, what the physical assessment is, what the pathophys of asthma is, what's the pharmacology I need to know for asthma, and what do I need to consider when it comes to, patient teaching, parent teaching, and child development. So it's the idea of, instead of teaching things in a segmented way, we teach them in a way that overlaps so the students don't recognize that, hey, I'm also learning pharmacology and assessment while I'm taking this pediatric primary care course. So it's all the idea of it all being integrated. And there's strong evidence to support integrated learning as a successful teaching pedagogy. And then finally, I wanted to share with you this pedagogy of feedback. I really feel strongly that good faculty are student-centered or learner-centered faculty are really good at feedback. And I'm going to give you a method of feedback here that's evidence-based, and that I'm going to actually give you the references that go along with it. But things that we need to consider is that feedback needs to be differentiated depending on who the learner is and how they best respond to the feedback. But there are also many levels to feedback, and the next slide is going to explain that a little bit better to you. But it's not just the feedback that comes from the faculty to the student. It's also peer feedback and feedback that comes from the student to the faculty. And so feedback has all of these nice layers and can be used in so many different ways, and not just in didactic learning and in clinical learning, but just in a multitude of ways that can be integrated in the classroom. And feedback has to be centered around how you know your students are going to absorb what they hear. So framing, how you frame your feedback is just as important as the actual message. So this is Emily Ray's RISE model. So we start at the bottom, and it's reflect, inquire, suggest, and elevate. And so I have a couple of different graphics on Emily's work for you. And these are different levels of feedback that you can use with students. So reflection is fairly self-explanatory. You want students to reflect on their work, and or you're reflecting on their work. And it's sort of a low level when we talk about feedback. And then the next level up is inquire. So your feedback is really focused around asking questions. So what about this? Or how do you feel about this? Or why did you think this? And so we're asking questions as we're framing the feedback that we want to give. Then the third level is suggest. So after you've asked questions, then you can start to introduce different ideas for improvement so that the student can elevate their current work. So after we've reflected and asked questions and made suggestions, then we can help the students raise their work to a higher level, so elevate. So again, the RISE model. Here is Emily's graphic for the RISE model. So this actually is used, she uses this for peer feedback. I think it could also be used for faculty to student feedback, but it helps frame what I said, like sometimes how you frame your message is more important than the message. So this helps frame the conversations towards the positive, and so it helps students and faculty to provide more productive critiques of student work, so that, again, the students will absorb the feedback in a positive way and be able to then elevate their work. So where I'd like to go with this lecture in the next few slides is really like for you to do some self-reflection about what your own personal teaching style is. So faculty often develop a teaching style based on what their own beliefs are of what constitutes good teaching, what their personal preferences are, and what they feel like their abilities are in the classroom. It's also strongly based on what the norms are at the time. So 20 years ago in the nursing classroom, all we did was lecture. And that was the norm at the time, and that's what the teaching style was. That was the cultural norm for teaching style in the classroom in nursing. It's no longer just lecture, though. That's no longer the norm. So, but your teaching style can also be defined by what you feel like the needs of your students are, what your personal beliefs are, and what behaviors you use in the classroom. So earlier I talked about learner-centered faculty, and that's really faculty that act as facilitators to learning. And then there are also faculty who are teacher-centered, and those are content experts that basically present information to students to help them learn. So what I'd like you to think about is, and you can go back a few slides, what are your teaching styles? What are your own personal teaching pedagogies? What were they? What are they now? What would you like them to be? And start to think about some of the ideas that you can integrate into your classroom that you haven't done before. So maybe you think integrated learning is fantastic, or maybe you want to do more peer feedback with your students. Especially in nursing, peer feedback is fantastic, especially with the availability of simulation. Allowing students to critique each other in simulation environments instead of just having faculty feedback is an awesome tool. You can also start to think about maybe you want to do more differentiated instruction. One of the things we're leaning towards in our classroom is allowing for multiple methods of assessment. And so if I want students to demonstrate mastery in informatics at the end of a term, I'm going to give them the parameters by which they have to demonstrate the mastery, but I'm going to let them choose how they do that. Is it an iMovie? Is it a keynote presentation? Is it a Prezi? Is it a Flipboard magazine? What is it that's going to show me that they can demonstrate mastery? And you allow students to be creative and express themselves, and they're often more engaged because you've given them some differentiated options. But anyway, these are things about personal teaching style that you need to consider. What are you comfortable with? What would you like to be more comfortable with? And as you move forward, then we can start to talk more and more about how technology can influence those things, and how you can integrate evidence-based pedagogy using technology. So here's the last question. Now that you've looked at pedagogy and how you use, what pedagogies you use in the classroom, and the kinds of pedagogies that you're comfortable with, and the things that you'd like to learn more about, the next question is, how can you use technology to enhance those? And so I would challenge you to listen to some of these other lectures about technology integration and how you can pair thoughtful technology with evidence-based pedagogy to just really elevate what you're doing with students. And the students appreciate this. The students appreciate that you've taken a chance, that you're doing something different, that you're allowing them a little bit more flexibility in their learning. And that all goes back to remembering that not every student learns the same way. So we need to learn to meet our students where they are and to help to teach in a way that 100% of our students are getting 100% of the content instead of 50% of the students getting 50% of the content. So we're looking at more effective teaching strategies with thoughtful integration of technology in order to elevate the level of the learning for the students. So thanks so much.